Okay, let's unpack this. Imagine your dog or cat, usually bounce it around, but now they're standing really stiff.
Mm-hmm.
Maybe their ears are pulled way back, forehead's all wrinkled, and they sort of can't open their mouth properly. It just looks wrong. Unsettling, really.
Yeah, that picture you're painting, that could definitely be an alarm bell for something quite specific and serious. Tetanus.
Tetanus,
Yeah.
right. We think of it with, like, rusty nails in people or horses, maybe.
Exactly. But our dogs and cats, they can get it too. It's thankfully less common for them, but it happens.
And that's exactly what we're diving into today. We've gathered, well, a whole stack of resources, clinical guides from vets, expert notes, some research papers,
Yeah.
to really get a handle on this disease in pets, because it feels a bit misunderstood sometimes.
Yeah. Our goal here in this deep dive is to sort of cut through the complexity and give you the essentials, what causes it, how to spot those really key, sometimes pretty weird signs.
Weird is a good word for some of them.
Definitely. And, how vets figure it out, how they treat it, and what you as a pet owner really need to know.
Think of it as like your focused briefing on pet tetanus. It's rare, sure, but seeing it early, that could be crucial.
So where does it start? The problem isn't really the bacteria causing direct damage. It's this incredibly powerful neurotoxin it makes
A neurotoxin, okay.
called tetanospasmin, and it's produced by a bacterium, Clostridium tetani.
Clostridium tetani. And this bacteria, it's kind of sneaky, isn't it? I read it forms spores.
That's right. It creates these super tough little packet spores that can just sit there, surviving for years in the environment.
Whereabouts? Like everywhere.
Pretty much soil, dust, even animal feces. They're really hardy.
Wow. And resistant to disinfectants, too, I saw.
Very resistant. But the spores themselves, they're dormant. They need the right conditions to sort of wake up and start churning out that toxin.
And those conditions are,
Low oxygen, an anaerobic environment. That's the key trigger.
okay, low oxygen. Now, here's something interesting from the sources. Dogs and cats are actually more resistant to this toxin than humans or horses are.
They are, yes. Significantly more resistant, relatively speaking. And cats even more so than dogs. So while they can get sick, it often takes a larger dose of toxin compared to, say, a horse. But they definitely aren't immune.
So how does the infection actually happen then? If they're resistant, those spores need to get in somewhere low oxygen.
Exactly. Usually through a wound. The classic example is a deep puncture wound, stepping on something sharp.
Right.
But the sources are clear. It doesn't have to be dramatic. It could be a really minor cut, a scrape that seemed okay, a bite wound, even something like a retained baby tooth causing issues, or a problem around a nail bed.
So you might not even find an obvious wound. It could be tiny or healed up already.
Precisely. It could be hard to find or look completely insignificant, but if it creates that little anaerobic pocket, the spores can germinate and start producing tetanospasmin.
And once that toxin is made,
What happens? It gets absorbed locally and then starts traveling. It actually moves up the peripheral nerves, heading towards the central nervous system, the spinal cord, and the brainstem.
okay, it's traveling up the nerves.
Ugh.
And this is where the real damage starts, right? The mechanism is fascinating. It doesn't directly make muscles contract.
No, that's the interesting part. It works by interfering with the inhibitory signals, the signals that tell muscles to stop contracting, to relax.
Ah, okay, so it's like cutting the brake lines.
That's a great analogy. It blocks the release of specific chemicals, neurotransmitters like glycine and GABA, that act as the brakes for muscle movement.
So the Gaussians just keep firing without any stop signals.
Exactly. The nerves keep telling the muscles to contract, leading to this continuous, uncontrolled muscle activity. Sustained, often painful contractions. Rigidity.
Which is what vets call spastic paralysis. Intense stiffness.
That's the word.
Now, one of the tricky things, it seems, is that these signs don't just pop up instantly after the wound happens.
No, there's an incubation period. It can vary quite a bit.
Yeah, the guides mentioned anywhere from a few days to several weeks. Usually, what, around 10 to 14 days on average?
That's typical, yeah. But it can be longer. And another really key point, the signs often get dramatically worse with stimulation.
Like what?
Sudden movements, loud noises, even bright lights. Anything that startles the animal can trigger more intense spasms.
Okay, good to know. And the disease itself, it can look different. Localized versus generalized.
Correct. Often, especially in dogs and cats, because of their resistance, it might start as localized tetanus.
Meaning just near the wound.
Yeah, you'll see stiffness or rigidity just in the limb or the muscles, close to where the infection started, maybe some muscle twitching in that area.
Can it stay like that?
Sometimes, especially in cats, it might stay localized and even resolve on its own, but it can also spread and progress to the more severe form.
Generalized tetanus.
Right. And that's when you see those really striking whole body signs. Widespread muscle rigidity just takes over.
That's where the sawhorse stance comes in.
Exactly. The animal looks frozen, all four legs stiffly extended out like a wooden sawhorse. It's very characteristic.
And lockjaw.
Yes, trismus, the technical term. The jaw muscles clamp down so hard they can't open their mouth. This leads to drooling, obviously, and they can't eat or drink.
Then there are those facial signs. You mentioned they can be bizarre.
They really can be. Often, they're the first things an owner notices. You get this expression called rhesus sardonicus.
The sinister smile.
Kind of, yeah. The lips are pulled back tightly, the forehead gets wrinkled, and the ears are often pulled erect and held really stiffly, sometimes close together.
You also see the third eyelids coming up.
Very common. Protrusion of the third eyelids. And sometimes the eyeballs themselves actually sink back into the sockets a bit in ophthalmos.
Oh, what else?
The tail might be held stiffly extended, straight up or out. Difficulty swallowing dysphagia is a big concern.
Because of aspiration pneumonia risk.
Exactly. If they can't swallow properly, saliva, food, water can go down the wrong way into the lungs. And difficulty breathing itself, dyspnea, is probably the most life-threatening aspect.
Why does that happen?
The toxin affects the respiratory muscles. Spasms of the larynx, the voice box, or the diaphragm can make breathing incredibly difficult, potentially leading to respiratory failure. It's a common cause of death, unfortunately.
That's scary. And in really severe cases.
You can see effects on the autonomic nervous system, the body's automatic controls. Things like heart rate and blood pressure can go haywire. They might retain urine, have vomiting, or regurgitation.
What about fever? Is that common?
Often, yes. But interestingly, it's usually not due to the infection itself spreading systemically. It's more from the intense heat generated by all that constant muscle contraction.
Right, just sheer metabolic activity. They're also super sensitive.
Hypersensitive to stimuli, yeah. An exaggerated startle response to touch or sound.
But through all of this, they're aware.
That's the really tough part. Generally, their consciousness isn't affected. They're awake and aware of the stiffness, the pain, the spasms.
Oh, that's awful. Can they have actual convulsions?
They can have what are called clonic spasms, these really painful, intense muscle contractions, sometimes leading to an arched back posture called opisthotonus.
Okay, so you see these signs, maybe some or all of them. How do vets actually pin down that it is tetanus? You said it's tricky.
It is. It's a major challenge because, as the research confirms, there isn't a simple, quick, definitive test you can run in most clinics to detect the toxin or the bacteria before you need to start treatment. Not reliably in live animals, anyway.
So no blood test that just says tetanus positive.
Unfortunately, no. The diagnosis is made primarily based on recognizing that unique cluster of clinical signs we just talked about.
The lockjaw, the facial expression, the stiffness.
Exactly. Combined with a history, if possible, of a potential wound, even if it wasn't obvious or seemed minor. A really thorough physical exam is key, searching meticulously for any sign of injury, assessing the muscle rigidity, the face, breathing, jaw tone, tail stiffness.
What about lab work? Does that help at all?
It can be supportive, but not definitive. Routine blood tests, like a chemistry panel, might show really high muscle enzyme levels, CK and AST, just from all the muscle damage due to the constant contractions.
Okay.
Blood gas analysis can tell you about their oxygen and carbon dioxide levels if breathing is compromised. Urinalysis might show myoglobin, which is released from damaged muscle.
But nothing confirms tetanus itself.
Not directly. Trying to culture C. tetani from a wound is technically possible, but very difficult because it needs strict anaerobic conditions and it's often overgrown by other bacteria. So a negative culture doesn't rule it out at all. And tests for the toxin in blood or tissue are generally not practical or reliable for pets during the illness.
So vets really have to rely on their clinical judgment.
Very much so. Recognizing the pattern and ruling out other conditions that could cause similar signs. Things like strychnine poisoning, certain drug reactions, rabies, meningitis, severe muscle inflammation, spinal problems, even low calcium.
Okay, so let's say the vet strongly suspects tetanus based on those classic signs. How do you actually treat it? It sounds like a massive undertaking.
It is. It's definitely a multifaceted approach, and it requires intensive care. There are sort of three main goals.
Okay, one.
One, neutralize any toxin that's still circulating in the blood, the stuff that hasn't latched onto the nerves yet. Two, eliminate the source of the bacteria of the wound so they stop making more toxin there. And 3, critically, provide intensive supportive care to manage the symptoms and keep the patient stable while the nervous system slowly recovers from the toxin that's already bound, because you can't reverse the bound toxin.
Got it. So step 1, deal with the wound if you can find it.
Yes. If a wound is identified, it needs to be thoroughly cleaned, flushed, and debrided. That means surgically removing any dead or contaminated tissue. This helps remove bacteria and exposes the area to oxygen, which Clostridium tetani hates.
Okay. What about antibiotics?
Antibiotics are definitely used. Their main job is to kill the C. tetani bacteria still present in the wound to shut down any further toxin production.
But they don't neutralize the toxin already made.
Correct. They don't affect the toxin that's already traveling up the nerves or bound there. Metronidazole is usually the drug of choice because it's excellent against anaerobic bacteria. Penicillin is another option, usually given for, say, 7 to 14 days.
All right. And then there's the antitoxin, TAT.
Yes, tetanus antitoxin. This is usually an equine origin product containing antibodies against the tetanospasmin toxin.
And its goal is?
To bind to and neutralize any toxin that's still free in the bloodstream or tissues before it can reach the nervous system.
So again, it doesn't help with the toxin already attached to the nerves.
Exactly, which is why it's most beneficial if given early in generalized cases or in localized cases that seem to be getting worse. It might limit the total dose of toxin that eventually binds.
How is it given?
For treatment, it's usually given slowly, intravenously, often diluted. There is a risk, though generally low in dogs and cats, of an allergic reaction because it comes from horses.
Anaphylaxis.
Potentially, yes, or a delayed reaction called serum sickness. So vets often pre-treat with antihistamines or steroids and give it very carefully.
Okay. Wound care, antibiotics, antitoxin. What else? This sounds like just the start.
Oh, it is. The absolute cornerstone of treatment, especially for generalized tetanus, is intensive supportive care. And a huge part of that is managing the muscle spasms and rigidity.
Muscle relaxants and sedatives.
Essential. Medications like methylcarbamol help relax the muscles. Sedatives like diazepam and dazolam or sometimes phenobarbital are used to reduce anxiety, control spasms, and keep the animal calm and rested. Often, these are given as continuous intravenous drips, CRIs, in severe cases.
So you just keep them continuously relaxed.
Exactly. Minimize those painful, exhausting spasms. Sometimes even stronger agents like propofol or alfaxolone infusions are needed for deep sedation, but that requires very close monitoring.
And this supportive care, it goes on for a long time.
A very long time. This is not a quick fix.
No.
Patients with generalized tetanus often need hospitalization for weeks. 3-4 weeks is common, sometimes even longer.
Wow. What does that involve day to day?
It's incredibly demanding nursing care.
Yeah.
They need a super quiet, dark environment. Minimal handling, minimal noise, minimal light. Remember how stimuli make things worse?
Right. How do they eat or drink with lockjaw?
They usually can't. Nutrition is a huge challenge. Most moderate to severe cases will need a feeding tube placed surgically, usually an esophagostomy or gastrostomy tube, directly into the esophagus or stomach.
Why not just try syringe feeding or temporary nose tube?
Because manipulating the mouth or throat can trigger severe spasms, and the risk of aspiration is too high. A surgically placed tube bypasses that and allows safe, long-term feeding and hydration.
Makes sense. What else for supportive care?
5E fluids for hydration. Careful bladder management, often needing a urinary catheter if they can't posture to urinate. Meticulous recumbency care, turning them every 2-4 hours to prevent pressure sores and lung collapse, keeping them on soft, clean bedding. Lubricating their eyes frequently if the third eyelids are up or they're not blinking normally.
And constant monitoring, I assume.
Constant, especially respiratory monitoring. Watching their breathing rate and effort, listening for signs of pneumonia, oxygen therapy if needed.
And sometimes more invasive breathing support.
In critical cases with severe laryngeal spasm or respiratory muscle failure, a temporary tracheostomy, a breathing tube directly into the windpipe, might be needed. And in referral centers, mechanical ventilation could be an option, though that's very complex and resource heavy.
So managing fever, watching for constipation, blood pressure, ECG, it's full-on ICU level care.
It really is, for weeks.
Okay, so after all that,
Yeah.
what's the prognosis? Can they recover fully?
The prognosis is really variable. It depends heavily on how severe the signs are when they start treatment, how quickly they respond, and whether they develop serious complications like aspiration pneumonia or respiratory failure.
But recovery is possible.
Yes, definitely. But it's slow, very slow, weeks to months, and often requires rehabilitation or physical therapy afterwards to regain strength and coordination.
How do the odds look for dogs versus cats?
For dogs with generalized tetanus, survival rates reported in studies vary, but with the kind of intensive care we've been discussing, recent reports show pretty good outcomes, sometimes 80–90% or even higher survival. Localized cases generally have a good prognosis.
What makes the prognosis worse for dogs?
Obviously, very severe signs from the outset: unable to stand, severe lockjaw preventing nutrition, major breathing problems, those autonomic issues. Developing complications like pneumonia is a major negative factor. Some studies suggest younger dogs or those with a very rapid onset might do worse.
And cats, you said they're more resistant.
They are, so their prognosis is generally considered a bit better. Localized tetanus often resolves well. Generalized tetanus is still very serious in cats, requiring intensive care, but their chances might be fair to good with that level of support.
Are there other factors influencing outcome?
Yes, things like how much toxin has already bound by the time treatment starts. Earlier treatment is better. If the wound is closer to the head, the toxin has a shorter path to the brainstem, which can sometimes mean a worse prognosis. And a shorter incubation period, less time between injury and signs, sometimes correlates with more severe disease.
Okay. Given that the bacteria is everywhere, how do we prevent this? What can owners do?
The number one thing, based on the sources, is good, prompt wound care.
Just cleaning any cuts or scrapes?
Yes. Cleaning them thoroughly, especially deep puncture wounds or anything obviously dirty. Flushing them well. If there's draining tissue, getting it debrided by a vet is helpful. For deep contaminated wounds, the guidelines suggest considering antibiotics like penicillin for a few days might help prevent C. tetani from getting established.
What about vaccination? Like we get tetanus shots.
There is a tetanus toxoid vaccine available for dogs and cats. However, unlike in people or horses, it is not routinely recommended for most pets.
Why not?
Primarily because the disease is relatively rare in dogs and cats compared to their high natural resistance. The risk-benefit for routine vaccination for every pet isn't generally considered favorable.
But sometimes it is used.
It might be considered in specific situations, maybe for dogs in really high-risk environments, like working farms where tetanus is common, or hunting dogs prone to puncture wounds in endemic areas. If used, it's usually an initial series of 2 shots, then boosters every couple of years.
And the antitoxin, TAT, can that be used preventatively?
Yes, it can. If an unvaccinated animal or one whose status is unknown gets I think the first is recognize those signs we talked about: the stiffness, the face, the lockjaw. If you see them, understand this is a true medical emergency. Get to a vet immediately.
And understand it's the toxin, not the bacteria directly, causing the main problem. Antibiotics help stop more toxin, but don't fix the existing effects.
Exactly. Also remember, the signs can be delayed days or even weeks after an injury you might have forgotten about.
Be prepared for the reality of treatment. It's likely going to involve prolonged, intensive, and yes, potentially very expensive hospitalization.
And that recovery is slow, weeks to months. It requires immense patience.
The cornerstone is that supportive nursing care while the body heals itself from the toxin's effects. TAT helps, but the day-to-day care is critical.
Absolutely. Discuss the potential complications like pneumonia or breathing failure openly with your vet. Understand the prognosis can be guarded, especially initially.
And finally, remember that good wound care is your best prevention strategy for everyday situations. Routine vaccination isn't standard for most pets.
Those are the core points, I think.
So we've really gone into the weeds on tetanus in pets today. It's quite something. From that tiny, tough spore in the environment
To the way the toxin hijacks the nervous system.
causing those incredibly dramatic body-wide signs. We've looked at how vets diagnose it, the sheer intensity of the treatment involved.
And that long, slow path to recovery.
I think the key takeaways really are: it's rare, but it's incredibly serious when it happens. Diagnosis relies heavily on spotting those unique clinical signs.
And survival hinges on that intensive, prolonged, supportive care. Recovery takes time, a lot of time.
Hopefully, understanding these signs means that if, heaven forbid, you ever encountered this, you'd recognize the emergency and act fast. That speed can make all the difference.
It really can. And here's a final thought to leave you with. Considering these Clostridium tetaniae spores are literally everywhere around us, in the soil, the dust, isn't it pretty remarkable?
What's remarkable?
How the combination of our pet's natural resistance and just basic, sensible wound care is usually enough to prevent this potentially devastating illness. It kind of highlights the constant, unseen biological defenses that are protecting them and us all the time. Makes you think.